Hello, everybody. This is Dr. Eric Fishman with EHRtv, live from Chicago, here at HIMSS 09. Today we'll be speaking with Dr. David Winn, founder and chairman of the board of e-MDs. Dr. Winn, hello.
Hi.
I understand that many, many years ago you needed some technology for your own medical practice and you started writing your own electronic medical record.
Yes, back in, I guess, the 86 time frame, 87 time frame, I wrote a very basic macro-based EMR using Paradox and PAL. And over several years, we saw our revenue increase through better revenue recognition and billing. On our CLIA scores for our lab, we were getting perfect scores. We actually had Prudential do an evaluation of our practice along with other practices. And out of the 100 or so practices in Austin, we were $37 per member per month versus a national average of $65 per member per month, with better outcomes, lower hospitalization, ER visits, and prescriptions were actually slightly higher, but the overall cost was less. So it began to prove to me that the EMR technology was going to be the wave of the future. I had a lot of patients that work for Dell and IBM and TI and other technology companies, and they said, this is fantastic, nobody's doing anything like this, you should market this product.
And so how long did you use it in your own office before you started a company to actually market the
I guess
product?
about 7 years, 8 years. And then what happened was we hired a developer. I was on the board of a company called Computer Language Research, so I'm a physician but also have a strong technology background. And we got a DBA early in to make sure that a design would pass muster. But I remember when the first developers we had looked at the code I'd written and he said, this is terrible.
But
and
it worked.
It worked, but I'm not a professional programmer. So what we really did is I had enough knowledge that I could recruit really top-notch talent and make sure that we did it right. In the early days, Microsoft was commissioned by FAAFP to evaluate all the vendors, and we were just big enough to sneak in at that point. And e-MDs, even back then, was rated #1 in database design. That was over Cerner, NextGen, everybody else.
You're always getting a lot of high ratings, and we'll get into that in just a moment. But tell us about the growth of e-MDs over the last 2 years, and maybe even the product changes and what the current state of the art is.
Well, we are growing anywhere from 16 to about 25% year over year. 16% lately. I think that's partly because of the product cycle. We're in a client-server technology. That is the #1 rated product by all the different major medical organizations. We are moving to a web-native application, a SaaS model, SaaS.
And when do you expect that will be available?
That'll be available in August. We already have people that have purchased that, very large groups that are waiting for that product to come out.
And is that the Razor product I've
Yes.
been hearing so much about?
Well, that's the current name for it. It'll probably be the commercialized name.
Tell me about the specific reasons why somebody would want e-MDs as opposed to a different
I
product.
think we excel at documentation, both the speed of documentation, the flexibility in our documentation. Even though I'm a strong proponent of structured data capture, we're able to incorporate that without bogging the physician down. We create attractive, elegant notes that can be looked at in a paragraph format or a more typical computer-generated format. We excel at clinical decision support so that we can really guide physicians along best practices and make sure that their quality is at the highest level for PQRI and other measurements.
And so the structured data, for instance, the evidence-based medicine, I understand that you have folks, for instance, Dr. Michael Stearns, who has a lot of experience with structured data.
Right. I was always interested in a external data model to the templating or data collection system, but that's not my area of expertise. And I found out about Dr. Stearns. He's past international director of SNOMED and has a fantastic data modeling background in HIT. So we recruited him, and he very rapidly went up the ladder and became CEO several months ago.
How did that feel, losing that title? Or I guess it would be called giving it away.
You know, he was much better in that capacity than I am. I'm a vision type of person. I don't have the best organizational skills. I know where my strengths are and where my weaknesses are, and Dr. Stearns was going to be able to take us to that next level of the billion-dollar company.
And I think you may well get there. Is there anything else that you would like to tell our viewers?
Well, appreciate the opportunity to tell you a little bit about our company, and I wish EHRtv the best of luck.
And I wish you as well. David, thank you.